In this video, we will be scrolling through slices of a sagittal CT with a bone window of the pelvis and the lumbar spine. We will be identifying bony landmarks along the way to help orient you to where we are in the body, for example, a more medial or lateral image. In this image set, bony structures will show up white and will be very easy to see. Keep in mind that we will not be specifically identifying structures in the abdomen, but we will identify and number the 5 lumbar vertebrae when we come to the appropriate slide. Here's just a reminder of the type of cuts we will be making in this image set, and I'll circle that for you right now. We will start laterally on one side of the body. I will point out when we reach the midline of this image set, and then from there, we'll move laterally toward the opposite side of the body. Those images we will see later in this presentation will look very similar to these next few, since those structures we will look at have symmetry at the midline. Let's get started. Our first landmark appears very quickly. We are already starting to see some bone here, which I'll circle quickly in blue. Let's orient ourselves to identify this bony landmark. I'll draw a line right now showing where we are in our CT image. Therefore, the bony landmark we see is the greater tubercle of the femur. The shaft of the femur will start to become clearer in the next few images, but I'm going to scroll through a few more images until a more noticeable landmark becomes visible. Here's the other bony landmark I just mentioned a few slides ago. I'll circle that quickly in black. This is the iliac crest. Let's move through a few more slides for it to become a little more prominent, and then we'll orient ourselves again. Let me draw a line now on the cartoon image to orient ourselves. We are right about here. And the reason I'm drawing it there is because we can see the shaft of the femur on our CT image. I'll circle that quickly. And we can also see the iliac crest. Take a second now to think about what our next major landmark is going to be. In the next few slides, you will be able to see the hip joint and the head of the femur very clearly, a landmark that you are still too lateral to see the vertebral bodies, but we cannot see the shaft of the femur anymore. Let's orient ourselves with this image. Remember that we've moved medial enough so that we can't see the shaft of the femur on our CT image. So I'll draw a line right about here on our cartoon image. The ischium is starting to come into view here. I'll circle that quickly in yellow. We have moved past the hip joint in this image. Let's quickly orient ourselves again. So I'll draw a line in black on that cartoon showing where we are. Just like that. Again, we've moved past the hip joint, which I'm circling in green on the cartoon, but we haven't yet seen the distinct border of the sacrum, and I'll just outline that in green as well on the cartoon image. Here is the distinct border of the sacrum. I'm just going to quickly circle the whole thing here in red. Time to orient ourselves. Remember, we are medial enough that we have passed the head of the femur and the hip joint, but are now starting to see a detailed outline of the sacrum. So I'm going to draw a line right here on our cartoon image. You may have also noticed these two sort of floating bones on the CT image, and I'm circling them in yellow right now. Those are the pubis and the ischium, and you can see in the cartoon image we've cut through both of them. And I'm going to just underline quickly the labels for them on the cartoon. If you are having trouble visualizing these on 2D images, I suggest you go down to the lab and view a 3D model of a pelvis to help orient yourself. The lumbar vertebra are starting to come into view in the next few slides. We haven't reached the vertebral canal, but since we can see parts of the lumbar vertebra, we are very close. Let's orient ourselves again. And I'll draw a line here showing that we're not medial enough to have entered the vertebral canal. Now we are entering the vertebral canal since we're starting to see some space next to the vertebral bodies. And I'll just very carefully outline that space in blue right here, just a little bit. Keep in mind that the vertebral canal will be a solid gray color on this picture since this is a bone window. We won't see structures like the conus medullaris or the cauda equina. This is the most medial image of this set. So now I'll use a picture of a vertebra to orient ourselves. I'll very quickly just draw a line on this cartoon image on the right, showing you that we're in the vertebral canal. This is a great slide to number the lumbar vertebra, so go ahead and pause this video here if you'd like to do so. We are moving laterally now, so the vertebral canal is disappearing. From here, keep in mind that since we have crossed the midline, much of these structures will be similar to those we looked at in the beginning of the presentation. For that reason, I won't be including the cartoon image to orient ourselves, but will quickly point out the structures we have already looked at. The vertebrae are now disappearing. The outline of the sacrum is coming into view once again. The hip joint and the head of the femur start to come back into view. The head of the femur starts to disappear, and we can see the shaft and greater tubercle appearing in the next few slides. We can see the iliac crest and the shaft of the femur. And this concludes this image set. Thank you so much for watching, and I hope you found this video helpful.